I'm going to look at some bone physiology in this section, starting with ossification. Ossification is the fancy term for bone maturing over time, meaning calcium will deposit into bone and other minerals over time, causing the bone to harden. That is skeletal maturity, and that is ossification. The two ways, hyaline cartilage, we find that in utero and newborns. That's where the bone itself is still cartilaginous, so it's hyaline cartilage. Eventually that hardens over time because of osteoblasts. Okay, know that term. Osteoblasts is bone builders. Articular cartilage will cover the end of bone, and the epiphyseal plate will allow for the longitudinal growth, which we'll look at in a few moments. Okay, oppositional growth is where the bone grows in diameter. The hormone responsible for this is growth hormone. That's released from the brain. You'll get into growth hormone and other endocrine hormones in ANP2. But for now, just know that the brain releases growth hormone, and one of the areas it targets is bone. And that's one of the reasons why you get growth over time. Scoliosis during the growth spurt, that's usually where you see it really start to take place, is during growth spurts. Scoliosis is abnormal curvature of the spine. Typically from a front view or an anterior view, you want the spine to be straight. In scoliosis, it's typically some sort of S-shaped curve. And there's all different kinds of S-shaped curves, but for right now, we'll just stick with that. And it is difficult to manage because there's all different types, structural scoliosis, functional scoliosis. Is there congenital anomalies in bone, and on it goes. But it can be helped and corrected and managed with the adjustments and therapies and so forth. If it's really bad, then surgical consultation might be needed, where they would insert rods. They can do certain kind of bracing and so forth. Okay, here we see the hyaline cartilage. The way I want you to picture this is, it's a very simple analogy here, but try to picture the bone as a soft clay. And if you keep taking minerals, which are hard, and sticking the minerals into the bone over and over and over again, eventually it's going to harden. Okay, that's what happens, essentially what happens over time. And we're seeing the articular cartilage here up top. There's the epiphyseal plate, so an area that allows for longitudinal growth. Okay, bones are dynamic, meaning they must stay in motion. Bone is not inactive, and it doesn't go dormant. You want bone to constantly be remodeling, and you want that remodeling to be healthy. And calcium is largely responsible for that remodeling. And in order to do that, you need a bunch of things in place. So you might want to write this down. I don't know if I have it written here. But some of the several things that you need for this remodeling to continue is calcium. So you do need healthy levels of calcium. And the pull of gravity on muscle, or that is to say, exercise. Okay. You also need other macro and micronutrients like vitamin D, And then healthy foods. You want to avoid pro-inflammatory foods, and you want to stick with as healthy of a diet as possible. So bottom line, it is diet and lifestyle that's going to help you with healthy bone growth and development over time. When calcium drops below homeostasis, the parathyroid glands, they are stimulated to release parathyroid hormones. I do want you to know that. The parathyroid glands, which are located on the posterior aspect of the thyroid, will release parathyroid hormone. The PTH activates osteoclasts to break down bone, which will bring calcium out of bone. So in other words, your body's like, I need calcium. Okay, now look at this statement. When calcium drops below homeostatic levels, okay, now write this down. Hypocalcemia. Hypo is below. Calcemia is calcium in the blood. Emia is related to blood stuff. Okay, hypocalcemia. Okay, now this is more of a concept topic I'm bringing up. So when calcium drops below homeostasis, your body is basically saying, okay, you're not really replacing it with diet, so I know where there's a good storage of calcium, and that's bone. So I will extract calcium from bone, and that will raise your blood calcium levels. In order to get calcium out of bone, you need to activate the osteoclasts. Osteoclasts break down bone, and when that happens, calcium is now removed from bone, gets into blood, and that will raise your blood calcium levels. The hormone that's responsible for that is parathyroid hormone. Okay, now I don't recommend tapping into this, because the more you do this, you're going to demineralize bone over time and get weak and brittle bones. So obviously not recommended to just flirt with constantly making parathyroid hormone being released, because that will demineralize your bone over time. So the best thing to do is maintain healthy calcium levels by diet and lifestyle. Okay, hypercalcemia. Hyper is too much of, and that means too much calcium found in the blood right now. And what can happen when that happens, if you have constantly or chronic too much calcium in blood, could be parathyroidism. So there's a problem with the parathyroid glands. Could be because of carcinoma or cancer of bone and other malignancies. Vitamin D toxicity, which is actually hard to get, but it's something to consider. Paget's disease, abnormal deposits of calcium on bone. Some signs and symptoms, that's what the SS means, signs and symptoms of hypercalcemia: constipation, anorexia, nausea, vomiting, skeletal muscle weakness. Keep in mind, calcium is responsible for muscle contraction, and with too much, you can have skeletal muscle weakness. Can create bone lesions because of weakness in bones, which I think I have some x-rays of that later. And abnormal heart rhythms, which that goes back to muscle contraction and calcium abnormalities. Hypocalcemia, levels too low because of hypoparathyroidism, renal tubular disease or kidney disease, or some sort of renal failure. The kidney is responsible for keeping good stuff and getting rid of bad stuff, but if there's failure going on, it's going to have a problem with regulating calcium. So signs and symptoms: muscle cramps, dementia, depression, neuromuscular irritability, and that's because of action potential and membrane potential problems, which we'll be talking about that later when we get to the muscle system, and osteoporosis. Okay, here's some diagrams, some pictures on osteoporosis. So over here on the right side, you're seeing this is an osteoporotic bone, it's losing its matrix. So this would be healthy bone. Here is the bone being demineralized, and that weakens the bone over time, and you can get fractures. So a common area would be the hip. That's a weight-bearing joint. So grandma takes a step, snap, there goes the hip, break through the femoral neck area, and that can happen anywhere. Okay, it doesn't have to just happen in the hip area. It can happen in your spine, the pelvis, the leg bones, wherever. Okay, it's simply a break because of demineralization of bone, and there's a variety of reasons for that: diet and lifestyle problems, demineralization problems, poor calcium absorption problems, other hormone problems. And then here you're seeing a surgical repair. So there's a hip replacement where they replace the ball and socket joint with artificial ball and socket. Okay, here's some diagrams on Paget's disease. On your left here, you're seeing, so this is an x-ray. Okay, you're seeing the pelvis. Here's the innominate here, or the os coxa. You're seeing the sacrum in that area. Here's lumbar spine. Okay, here's the femur head. And you're also seeing the femur neck right here, and then the shaft, the diaphysis of the femur. Okay. Now, if you look at the right side, and how do we know it's right? There's your marker. Typically on X-ray, you're going to mark your films right or left, so that the radiologist and whoever else is looking at the film knows what you're looking at. So their right leg, as you can see here, has some demineralization and abnormal calcium deposits going on. Compare that to the left side. This one looks fairly normal. Okay, you can see the cortical margin here. There's a medullary cavity. This has a typical X-ray bone look. And then this side, just keep going back and forth looking at the difference. The sclerotic appearance, which all that white stuff that you're seeing, is abnormal calcium deposits in bone. That's Paget's disease. These abnormal calcium deposits that can happen. Here in the middle, the skull is enlarged because of abnormal calcium deposits, giving the person, a big looking head. And then over here on your reading right, you're seeing a normal bone. So there's your white cortical margin, the bone cortex, with that kind of grayish middle part. That's the medullary area. So this is normal. This is what you want to see. Now look at this side. It's very sclerotic, very white appearance. Things that are very white on X-ray is because it's very dense. Okay, so the more dense it is, the whiter it appears on X-ray. For example, if you took an X-ray of a steel plate or titanium that's in there, it would be a very loud, sharp, white color. And so calcium, the more calcium deposits you get, the thicker the bone gets, the more dense it is, so it has that sclerotic appearance on X-ray. Okay, and this, by the way, is a lateral view of the knee. So there's the patella. Here's the distal end of the femur, and this is the proximal end of the tibia. And here's the tibia there, and the little bone next to it is the fibula. Okay, same on this side. There's the tibia, and there's the fibula. Here's the distal end of the femur, and there's your patella. Okay, a lateral X-ray, meaning a side view. Okay, with bony remodeling, very important, because this is our diet and lifestyle. This is the stress, the good stress against bone, the pull against gravity against bone, and the enthesis, which we talked about that in the prior lecture. The enthesis, where muscle tapers into a tendon and attaches to bone, is constantly pulling on bone, which means it constantly has to be remodeled and repaired, which keeps it strong. That's a good thing. If you're sedentary or bedridden, you're not getting that pull against gravity, so then bone will acclimate to you doing nothing. So again, it begins to soften and demineralize over time. And this statement here, bone mass loss, reminds me of the movie WALL-E. It's an animation. Great film because it completely makes fun of humans, which sometimes I enjoy that. And in that one of the things they were making fun of is how much we're marketed to, bombarded with, television, and all those people were on those futuristic electric scooter things, just hovering around, not walking, not doing anything. And WALL-E, who's the unsung hero, kind of an outdated robot, comes to the rescue, and the bad guy turns out to be the computer of the ship and doesn't want the captain of the ship or any of the people to leave. Basically, he's holding them hostage. And one of the statements that was made, if you've seen the film, is the captain wants to get out and walk around, and the computer was like, you can't, because your bone mass and your bone density has been lost because of your sedentary lifestyle. And it was just funny how it was kind of making fun of how computers and technology and all that kind of stuff is basically controlling humans. So if you haven't seen the film, great animation. But point is if you're bedridden. Now, in realistic terms, those of you who are going to deal with injured people that have to be bedridden, hospice care, seniors, nasty surgery and whatever recovery where they just have to be bedridden. It's really important to get them up and moving as soon as possible. And of course, that's my side of the healthcare field. I'm a big fan of movement and therapies and rehab, and whether it's active or passive, get things moving, get them up and going as soon as possible. Okay, with youth these days, I'm just barely going to touch on this. Okay, this is more of an ANP2 thing because in that section we get into the gastrointestinal system and nutrition. But the quick version is this. Today we basically have a problem with young people, children, and poor diet, poor lifestyle, and they're starting to obtain diseases and disorders that you normally don't see unless you're an adult. And now we're seeing those adult diseases in kids, like type 2 diabetes, obesity, bone softening like osteoporosis, osteopenia. And one of them, there's a bunch of things that can cause this, but one in particular, popular one, is soft drinks. Okay, now soft drinks have a lot of side effects because of the chemicals that they have, the high fructose corn syrup, the coloration, artificial flavoring, the caffeine, the phosphoric acid, and these do weaken bone. Now, you're dealing with a young kid here. Keep in mind they're still going through oppositional growth, which is where the bone grows in width, and longitudinal growth, where the bone grows in length. Okay, please know those. Oppositional, bone grows in width. Longitudinal, bone grows in length. This will mess with that process, and it also inhibits adequate calcium deposits in the matrix of bone. So earlier we looked at those slides, that clay area, so to speak, where you can keep on depositing minerals where it will harden over time. If you block that process because of diet and lifestyle, they're going to age into a immature skeleton because the ossification process was diminished. So it's very important that in youth, the diet and exercise be promoted so that they can age into a healthy skeleton, so that by the time they're in their full adult mature skeleton, which is in your late teens to early 20s, it's not already demineralized. Okay, so a lot of kids these days, they're already way behind the curve at age 20 with a bone mass of like 80%, so it's a 20% loss, and you're not going to get that back. It is what it is. The best you can do is maintain. So there's no reason at age 20 to have 20% bone mineral loss already because of the way you grew up with diet and lifestyle stuff. Okay? So the quick, easy version is do the best you can to maintain a healthy diet, healthy lifestyle that pull against gravity, get rid of the video games and the excessive amounts of TV and tablets and so forth. From some of the neuropediatric research that I've read, and they're being lenient, I think, they want you to limit all electronics on all levels 1 to 2 hours a day. That's it. And of course, we're seeing astronomical numbers with kids spending time on, video games and computers and tablets and so forth that far exceed that 1 to 2 hours a day. Okay, Rickets is a bone disorder because of abnormal calcification of bone. So you get these bowing deformities because the bone is soft and it bends. And it's because of lack of calcium and or vitamin D in the diet. Now in the U.S., we have gotten a little bit better at this because a lot of foods, even if the food isn't good for you, like Fruit Loops, a lot of sugar, but they still fortify it with calcium. Okay, so a lot of foods are fortified these days to try to prevent this. You certainly see this in third world countries. Here's some more diagrams. On the right here, you're seeing an x-ray. This is youth. Okay, so you can see the growth plates, those lines there. This is the femur, the tibia there, and you're almost seeing the ankle bones. And you're seeing that bowing deformity. Okay, a bowing deformity. A quick note on vitamin D deficiency. Again, more of an ANP2 nutrition gut thing, but vitamin D is amazing for the body. Lots of people are deficient. Easy blood lab to obtain the results, and just simply supplement with it. And my favorite supplement for it is Biodemulsion Forte from Biotics Research. The best one on the market because it's micellized and emulsified, because vitamin D is a fat-soluble vitamin. It's oral, it's liquid, highly absorbed, easy to take, very cost-effective. One bottle has 750 drops in it. It's about $20 or so, and it's just wonderful. It's a great high-class supplement, and you just take several drops a day. Depending on your blood lab results, it's going to depend on how many drops that you take. But anyway, so vitamin D deficiency can hurt the brain, hurt your circulatory system, it hurts the muscles, hurts your respiratory system, hurts the pancreas, hurts your bone, hurts your immune system, hurts your gut. I mean, vitamin D, especially D3, cholecalciferol, does a ton of things in your body. Now, obviously, we don't have time to get into all that, but it is a fascinating fat-soluble vitamin and has so many health benefits to us. And there on your left side, you're seeing an animation of Rickets. Here's a normal lumbopelvic with your femur heads and the diaphysis and all that. And then in Rickets, you're seeing that bowing deformity and brittle bone because of demineralization due to deficiencies, calcium and vitamin D.